We concern about a little bit in business-wise. Today in the healthcare, they're facing a lot of challenges and complexity. Just give you a little review, quick review, what kind of platform I used. Actually, I'm IT and Business Development Manager and SSI Engineers. I'm working with Microsoft Dynamics the last 6 years. This is my field. There are a lot of challenges we facing this field, and still until now there are no solutions. The U.S. government, they losing between 17 to 29 billion dollars every year for this kind of challenges they're facing in healthcare. Using the platform Microsoft Business Dynamics as an engine of programming, Microsoft Visual Studio C#, database, SQL Server, as a web portal, web service. We will talking about the challenges, the solutions, how we can access the right resources at the right time, secure remote access, how it's going to be secure from mobile handheld or laptop, how these mobility solutions improve in healthcare, the problems that I already talked about, the solutions, how is the workflow business process automation it succeed to solve this problem, how we can integrate these kind of software together from the providers such as insurance company, labs, radiologies, health plans, federal government, and the system architectures and component. Actually, these kind of applications I already implemented a couple of years ago on levels of organizations and connect them to locations. It's a little bit similar, but now it's more bigger because we're going to connect a lot of applications, a lot of database together. Actually, they're facing the RHIO, the Regional Healthcare Information Organization. It's non-profit organization. It's actually it's a government. They try to connect these companies together, but they're facing a lot of challenges of the integration and incompatibility between these systems. The challenges in the mobility bandwidth, the handheld or laptops, they have a lot of course, they're accessing big images, big results, labs, radiologies, they have bandwidth, losing connection, they fear of losing connections, power consumption, they work about 4 to 6 hours, the same PDA or laptops, accessing critical information, that is very critical for the patients, it's because it's a privacy. I tried working hard on this to solve this problem, how to access this information to be secure. I tried to solve this problem in the mobility solutions, offline data synchronization and mobile access. We create small database, it's called metadatabase. It's similar to the one in the server. The mobile access, the mobile client, he can synchronize and get just his own data on his laptop, on his locally, and go disconnect his connection with the server and work whatever he wants. After that, he can get online and synchronize all the data, and the server give him an options. If there's somebody change this data, because he's the owner of this data, he can accept to keep the changes or put his data. That's its reduced power consumption. Image processing and convert the images to text on the server side and simulate the text and send it to the mobile client. That's its reduced power consumption. Execute high level of function at the server side and send the result to the mobile client. Access critical information depends on the level of permission. That's reduced bandwidth. How's that work? There are 4 levels or 5 levels of security. The mobile access or the user, let's say, such as doctors or physicians or technician or clinician, he can access depends on his permissions. He can pull up his own information. Let's say the kind of this security level, read only, user level, business unit level, business parent user level, and organizational level as a CEOs and executives. Another solution of mobility solution, wireless LAN services. The Wi-Fi service supported by wireless LAN performance and wireless mesh network solutions give the staff freedom to roam throughout the healthcare facilities. For example, a doctor, he can go around in the hospital and open any kind of information it's recorded for the patient, examine the results, let's say from the X-ray or the lab. The automation, it's with the mobility, they're working together at the same time. Send the results to the doctors, he examine it, give the right information to the, let's say, the nurses or doctors, and store this patient information in history like social security or credit card history for future use. This way he can access the information anytime, anywhere, any place in the hospital, let's say facility or emergency room. The research shows that estimate healthcare drugs-related errors cost U.S. economy between $17 and $29 billion each year. It's real numbers. The healthcare is very complicated right now. By the way, in 2015, their new regulation and rules, every single health provider, they have to have this information electronically. There's no paperwork, no anymore. Just about 20% from the healthcare provider, they have it electronically. Other healthcare providers, they have it in paperwork. They're still working in paperwork. Anywhere, anytime, access the right resources at the right time. That's, as you see in the pictures, the nurse or the doctor, he can see when we reduce the time, we can give more time with the patient. We can access the patient information, all his tests, X-ray, labs, his treatment, what kind of treatment he take, examine the results, all these on bedside. Actually, he can, these kind of laptops, actually it's famous, it's called Norton, these kind of laptops, but the mobility, the workflow, it's work together with the mobility to access this information and pull up the patient information and the histories of the patient. Remote access, secure remote access. Secure remote access is connectivity and web portal based on VPN router or VPN gateway. That's from the outside. And from the inside, it's going to be NAT. Actually, NAT stands for Network Addressing Translator. That's another level of security. Let's say a doctor, he get a phone calls from the emergency room. There's something he want to consult. He can access the information of the patient in his home or from his office, and take them a walk how they take the instruction what they have to do with the patient. These are pictures how the access, remote access secure. The mobile client, he can access it through the firewall. The terminal servers, it gives the permissions to the client to access the applications and what kind of information he can open in his site. How the mobility solution improves in the healthcare. They can significantly contribute to lower scaling healthcare costs by reducing duplicates. The nurse, she can or he can enter the information on the bedside of the patients. The physicians can write prescription and access information and collaborate with the expert peer at the patient bedside. All this information is going to be recorded for history and for future use. Real-time access to accurate patient data, including clinical histories, treatment, medication, test, lab, result, all this information, insurance, what kind of coverage information, what he should pay with the copay. This information, it's accessible, but that's the mobility improves in the healthcare. Now I'm talking about the mobility, the problem with the mobility. The problem is the federal